So meningitis is an infection of the brain, actually the lining of the brain. It can be caused by different things. So it can be caused by some bacteria, some viruses. What we're talking about with this outbreak is a bacteria, certain type of bacteria called meningococcus. And it's a very serious infection because with some types of meningitis, particularly this meningococcus, meningitis B, unfortunately, it can be fatal in around 1 in 10 cases. So it's incredibly serious. There's lots of signs and symptoms that unfortunately overlap with other things. So people have said it can feel a bit like having a hangover with a headache. You can feel sort of achy and very exhausted, which obviously feels a bit like flu. The specific things to look out for with meningitis would be a temperature alongside having a headache, a sensitivity to looking at the lights, a stiff neck, and getting worse and worse. So that's sort of really crucial. We often talk about the rash associated with meningitis. That can be a very late sign. So if you do see a rash and the rash of meningitis doesn't disappear when you press it with a glass, then that is a medical emergency and you should be calling 999. So, in children and babies, particularly under 5, we actually vaccinate against a lot of the different types of meningitis, and those children will be protected, thankfully. But if you're not vaccinated, then the sort of symptoms a baby or a child could have. So, in a baby who can't tell you how they feel, they're often not feeding, they may have a fever, being more tired than normal, the rash, anything a parent is not happy with. And in a toddler or a child might be complaining that their eyes hurt, that they have a headache, feeling like they've got sore legs, sore body, very tired, and a fever. And as you can hear, the trouble with these type of symptoms is these are the symptoms of meningitis, but they can also be symptoms of quite normal mild infections that I look after with kids every day, every week in general practice. So it can be really hard to know the difference. When you listen to people who've either had meningitis or parents of children who've had meningitis, one of the things they talk about is how rapid it is, which I suppose is quite unusual in terms of other infections. People get worse within a matter of minutes and hours, and that's, I suppose, quite uncommon in terms of other sort of infections people have. And when you hear about young adults talk about having had meningitis and thankfully surviving, one of the things they will say is really how awful they felt. They were not able to walk around their house, they were not able to pick up the phone to phone their parents. You feel very, very unwell very quickly. So when we talk about meningitis, we are talking about different infections. So there are definitely some of those infections that we do vaccinate against, specifically meningitis B when it comes to children under 5, and then meningitis A, C, W, and Y when it comes to older children and this cohort of young adults who are affected. So vaccination is a great way to prevent it. For the young adults who are living in Kent at the university, who were at the club, that seems to have been the sort of epicenter of this outbreak, they will be offered very quick antibiotics, even if they were having no symptoms. We know that's incredibly effective if you've started to develop meningitis or if you've started to have the bacteria, and to prevent it, the antibiotics will be life-saving, have to be given very quickly. So that is really the best way to prevent it. Actually, meningitis, thankfully, is much less infectious than those type of infections like COVID or like measles, but it does spread in environments like a university hall of residence where young adults are all living and socializing very close together, the sort of socializing that would happen in a club where they might be sharing drinks, sharing vapes, kissing, all of that sort of stuff is how meningitis spreads. Look, they say it's unprecedented and they seems to have caught everybody by surprise. And as I say, this all does happen very quickly. It's not sort of over days, it's really over hours. And that's obviously what's happened with this very sad news at the weekend about the two people who have died. I'm slightly concerned that already we're hearing signals that the vaccination stocks are running low. So people who are trying to sort of get vaccines outside of Canterbury and Kent are struggling to do that. I think the response within Canterbury and Kent has been very good, and I would urge everybody who was in that area or who is in that area to follow that guidance to get the antibiotics, get the vaccination. I find that there's always a bit of a disconnect between what actually happens on the ground and how people feel and what the public health agencies are saying and trying to say. So I am a GP. I see parents and families pretty much every day. I'm also the parent myself of two young adults in this sort of age category. So I've got lots of friends who are contacting me in the last couple of days, should we get the kids vaccinated? And I think there's a real disconnect between what's put out by the health agencies. Don't worry if you don't live in those areas, because I can't imagine any parent could not be worried. Obviously, it's all over the news. Kids are vulnerable, young adults are vulnerable. We know what their behaviors are like. Nobody would want to curb those behaviors. We saw in the pandemic how bad it was to try and stop young people living their lives. And I really think that given we're not even 6 years, 5 years out of a pandemic, I really feel that the responses in terms of things like vaccine stock and just in terms of the communication with parents and young adults could be improved. Well, this is what happens, isn't it? You'll have sort of like somebody in authority in healthcare saying they're worried, and then parents who live elsewhere are told not to worry. So it's a very sort of jarring thing to hear as a parent. I really don't think that if you are outside of the Canterbury and Kent area, there is a worry at this stage because it is very contained. I think it's terribly concerning if you are in that area. And I'm sure that's very difficult for those families who do have students at the university or who were in that club. It's hard for other people to see the news and then just to sort of sit back and say, "Oh, well, that's okay. I'm not going to get my child vaccinated," especially when you hear the health secretary say he is worried. Of course, we're going to be very, very vigilant and very concerned.